Hi, here we will learn about preventing infection in newborn babies, especially at home as well as at NICU. We all know that prevention is better than cure. It is very important in newborns because if a newborn gets infected, then there is a very high chance of severe disease and even death of the baby. So here there's a case scenario. A mother is feeding her baby and doing kangaroo mother care in the NICU. And during feeding, the diaper becomes loose and the motion of the baby has leaked on the skin of the mother and her dress also. And the nurse wipes the area with a gauze soaked in alcohol-based solution. And the baby is continued on feeding, that is kangaroo mother care and non-nutritive sucking. The next day, the baby was lethargic. There is blood in stool, vomiting, and abdominal distension, and the sepsis screen is positive. Baby is having severe infection of the intestine. So, what has gone wrong is that if the baby has passed a stool and the diaper contains motion, it is important to remove the motion before feeding or before doing kangaroo mother care. So, remove the motion, clean the diaper area, and wash the hands with soap and water, and then you do feeding or kangaroo mother care. While doing, if your body and the dress is contaminated with the baby's stool, then it is better to have a bath, change the dress, and wash your hands with soap and water before doing the feeding. Okay, and so while feeding, the important is that bath should be done daily, and whenever your body is contaminated with stool, with soap, and change the dress daily, or if it is contaminated with stool, and avoid wiping the breast with the wipes or any other thing before feeding or expressing milk. Keep your breast dry, and do not try to avoid using excessive undergarments covering the breast, and because it will keep the area wet and more chance of infection. Do hand wash with soap and water before feeding and before changing diaper, before expressing your milk, or if your hand is dirty. And always sterilize the feeding utensil and breast pump before each use by washing them with soap water, then washing with warm water, and then submerging the utensils and breast pump parts under boiling water for 15 minutes, or keeping them after washing with soap water and warm water in a steam sterilizer, keeping the parts in the steam sterilizer for 6 minutes. And sterile feed preparation is important. That means boil the water each time and avoid using hot water taken from flask. And use the sterile disposable feeding tubes and syringes. So if you want to prevent infection, then there is hand hygiene, which is the most important. Second is you have to prevent infection during feeding, kangaroo mother care. Then there are actually 6 stages of prevention of hospital-acquired infection or even home infection. And personal protective equipment like mask and gloves also play a role. Then if the baby has IV lines, then you can prevent infection through the IV line. The baby is on airway support or breathing support like ventilator and CPAP, then you can prevent pneumonia because of that. If the baby is having urinary catheter, then you can prevent infection from that. And then vaccination of the caretaker or the NICU health worker. Now, the hospital-acquired infection is an infection that is acquired in the hospital, which was not present before or which was not incubating at the time of hospital admission. And it can happen because of the preterm, as the preterms have very poor immune system. And in babies who have venous catheter, IV lines, central line, ventilator support, or urinary catheter, or babies on parenteral nutrition, total parenteral nutrition, IV nutrition, may also have infection. And exposure to broad spectrum antibiotics can also predispose the baby to infection. So how to prevent infection? It is basically by hand wash. Hand wash is the single most important intervention, and it is important that all the doctors, the nurses, and the staff and the parents do the hand hygiene. Uh, Now, hand hygiene can be used by using alcohol-based solution for 20 to 30 seconds before touching the baby, or by hand wash with soap and water for 40 to 60 seconds. And there are 6 steps. The first step is by palm to palm washing, and second step is over the back of the hand, and third step is by interlocking the fingers, and fourth step is the washing on the knuckles of the fingers, and fifth step is on the thumb of the fingers, and the sixth step is at the tip of the fingers or the distal part of the fingers. And there are 5 moments of hand hygiene to prevent infection in the baby. That is, before touching the baby, before doing any sterile procedure on the baby, like insertion of IV line or feeding tube, and before, after touching the body fluid of the baby, and after touching the baby, and after moving away from the baby's surroundings. And before entering the NICU, you should wash your hands, be a parent or a nurse or a doctor. You should wash your hands for at least 5 to 10 minutes, thoroughly wash, and then meticulous hand hygiene before and after every patient contact. There should be sufficient amount of things, water, hand washing things, alcohol-based hand hygiene dispenser with each baby. And if you are using glove, then you have to wash your hands before wearing glove or and after wearing the glove. And it can be done with soap as well as alcohol-based rubs. However, soap and water is better than alcohol-based rub, especially if the hand is visibly soiled with the urine motion or stools or blood of the baby. Fingernails should be trimmed if you are taking care of babies, because fingernails contain a lot of microorganisms, especially Pseudomonas aeruginosa. And you should remove the jewelry, rings, bracelets, wrist watches that also contains gram-negative bacteria. And some NICUs practice the habit of hand hygiene ambassadors, who are basically nurses or junior doctors who will be giving the hand washing solution and hand rub to the other healthcare workers and parents periodically, especially during the 5 moments of hand hygiene. Then personal protective equipment. So in some infections like multi-drug resistant organisms like Staph aureus, you can take contact precaution, that is by wearing gloves and gown. And in some infection like Nipah virus infection, pertussis or respiratory syncytial virus, that is a spread by droplet, you can take the droplet precaution by wearing the mask. And in some infections like COVID-19, measles, varicella, pulmonary tuberculosis, you can wear the N95 mask. And what are the 6 stages of prevention of infection in the baby? First is by preventing the entry of the microbe to the baby care area. And that is by ensuring clean baby care area, hand washing before entering the baby care area, and even double doors at the entry, and restricted visitor entry with mask, use of mask, and restricted mobile phone use. Mobile phone is also a good way of transmitting disease. And stage 2 is preventing proliferation of bacteria and the viruses in the baby care area. Therefore, there should be adequate spacing between the baby beds, and hand washing should be nearer to the baby bed. And wall surfaces and floors should be easily cleanable. Then there should be continuous water supply, and the waste should be segregated adequately, and housekeeping routines are important. Therefore, you should clean the surfaces with the adequate appropriate measures. And stage 3. So what are the appropriate measures that we say? This is as per the Kaya Kalpa guideline in India, where we clean the monitors, ventilator with a sporicide disinfectant twice a day. We clean the laryngoscope blades and measuring tape, stethoscope with spirit before and after use. And we clean the instrument, injection tray, feeding utensil, swab container by washing with soap water, then with boiling and keeping in boiled water for 10 minutes. And we clean the oxygen suction tube, face mask, ampoule, and reservoir after each use by washing with soap water and submerging in glutaraldehyde for 4 hours, and then subsequently rinsing in sterile water. We clean the areas where doctors, nurses, and technicians stay twice a day with damp mop with detergent and water, followed by drying. drying, and wash the bucket and slippers once a day and as and when required with soap water and followed by drying. And wash the soiled linen and sluicing by soaking with clean water with bleaching powder 0.5% strength for 30 minutes and then washing again with detergent or laundry in hot water. Cleaning the mops after every use by soaking in clean water with bleaching powder 0.5% strength and washing again with detergent and water to remove the bleach. Then stage 3 is preventing the spread of infection to the baby and from baby to baby. This is by ensuring hand hygiene at the time of 5 moments of hand hygiene, which we discussed in previous slide. And nurse to patient ratio is important. If the baby is very sick, requiring ventilator and CPAP, surgical cases, then we need a 1:1 ratio. Nurse to patient ratio can be lesser, 1:3 or 1:2 in a intermediate care or lesser care baby and less intensive care baby. And disposable items like feeding tube, suction tube, diaper, syringe, IV extension, ventilator, CPAP circuit, adhesive, sterile glove, medicine vial should be there. And dedicated stethoscope, measuring tape, thermometer, torch should be available at each bed. And preparation of medication, fluid, and total parenteral nutrition should be done under sterile precaution. Stage 4 is preventing the entry of bacteria or virus into the baby by avoiding skin injury, especially during adhesive removal and use of skin-friendly adhesives like Tegaderm, and hand hygiene, cord care and eye care, and care bundles to prevent IV line infection, ventilator associated infection, and catheter associated infection, urinary catheter associated infection. And stage 5 is to enhance the immunity of the baby. That is by encouraging express breast milk use, early breastfeeding, kangaroo mother care, probiotics, antifungal prophylaxis. And stage 6 is better administrative practice, that is having a written antibiotic policy, antibiotic stewardship, hospital infection control committee with written infection control policies, motivation of staff and leadership of nurses, and dealing with outbreaks, vaccination of healthcare workers, and also secret services to know what is your hand hygiene complaints in your unit. Then central line associated bloodstream infection is very common, and that is because of the duration of central line. So, longer the duration, more chance of infection from the central line. So, the bundle care approach is a group of evidence-based interventions that is used to prevent infection. In the case of central lines or peripheral lines, most important is the hand hygiene and optimization of the central line insertion, that is insert the central line under sterile care, sterile procedure, and maintain it in a sterile manner, and removing the central line as soon as possible. So initiation and advancement of breast milk and enteral feeding in very low birth weight baby, then infection surveillance and communication, antimicrobial stewardship and use of organism-specific preventive strategies like active surveillance for MRSA, that is methicillin-resistant Staphylococcus aureus, and fluconazole prophylaxis against fungal colonization. Then during insertion of the central line or peripheral line, very important is the hand hygiene, that is washing the hand with soap water and wearing the sterile glove. Using aseptic technique, you clean the area with chlorhexidine, and then using maximal sterile barrier, that is cap, mask, sterile gown, sterile glove, sterile drape that completely cover the infant. Standardization of catheter insertion kit, which contains all the equipment needed for the central line insertion. The sterile occlusive dressing should be placed over the entry site of the central line. The sterile dressing should be changed only if it is damped or soiled or loosened, and 2 persons should be there for changing the dressing. And while injecting through the hub of the central line or peripheral line, we need to scrub the hub for at least 15 seconds and then allow it to dry for 10 seconds. Nowadays, we don't use open systems with cap and lure lock. Rather, we use closed system with stop cocks, that is the Q side. And we clean for 15 seconds so that the microbes are eliminated as far as possible. Then if it is a peripheral line, you should change the tubing once in every 24 hours. If it is a central line, you can change once in 3 to 4 days. And tubings must be changed for every infusion of blood product. And needleless connectors should be changed at the same time as tubing. And while changing the tubing, you need 2 clinicians. One is a sterile clinician who does the change, and the other is a non-sterile assistant who assists in the change. And you should daily review for the immediate removal of the catheter, because longer the catheter stays, more chance of infection. And if the baby is bacteremic, that is, blood contains bacterium, then you need to remove the catheter and in order to eradicate the infection. Then comes the ventilator-associated infection, pneumonia. This is a pneumonia in a patient who require a device to assist or control respiration through tracheostomy or endotracheal tube within 48 hours before the onset of the infection. Now, it may be responsible for as much as 1/3 of healthcare related infection, and it is common in low birth weight babies, prolonged mechanical ventilation, sedation, paralytic needed babies, and frequent suctioning, reintubation, and steroid use. So the bacteria can come from the endogenous within the body of the baby from its own secretion, oral and pharyngeal or gastric pooling and tracheal secretion, or it can be exogenous from the healthcare worker's hand. Therefore, hand wash is important. Ventilator circuit and the biofilm of the endotracheal tube. So the bundle approach to prevent ventilator-associated pneumonia include elevating the head for at least 30 to 45 degrees to prevent aspiration of contaminated oropharyngeal and gastric fluid. Hand wash before and after contact with respiratory equipment should reduce the cross-contamination between patients. Suctioning of the oropharynx around the endotracheal tube before adjusting or removing it may reduce the risk of aspiration of contaminated secretion. Separate the suctioning equipment for tracheal and oral secretion. And respiratory tubing should be draining away or at the level of ventilated infant, so that the secretions in the tubing does not go into the lungs of the baby. And the breathing circuit do not need routine changing unless they become visibly soiled or malfunction. Then assess the baby for removing the endotracheal tube as soon as possible. Use of non-invasive techniques like nasal CPAP and nasal prong ventilation reduces SWAP. Reintubation after extubation should be also avoided as far as possible. And then you can come to the bundle approach to prevent urinary tract infection if a catheter is there. So insert the urinary catheter only when necessary, and it should be done in an aseptic manner. And keep the urinary bag below the bladder of the baby. It should not be kept above, because that will lead to the backflow of the urine into the bladder and cause infection. And a daily review for the early removal of the catheter as early as possible. Then the healthcare workers also need vaccination against influenza, which can be done annually, and then against pertussis, that is a DTaP vaccine, and for against chickenpox, if they do not have immunity against chickenpox, 2 doses of vaccine can be given. Then cytomegalovirus infection is common in very low birth weight baby, therefore do not share express breast milk and wash hands often with soap water. Then group B streptococcus and other gram-negative peripartum infection can be prevented by intrapartum antibiotic prophylaxis to the mother can reduce infection in the baby. Then staphylococcus infection can be prevented by mandatory hand washing, isolation of babies with the Staphylococcus aureus methicillin-resistant aureus disease, and cohorting such babies. The take-home message, therefore, is that NICU staff, the parents should regard infections as preventable and unacceptable, maintaining a zero tolerance unit culture. And second is basic infection control practices should be there. Excellent hand hygiene, compliance. Hand should be washed, especially before giving feed, or before preparing feed, or before expressing milk, or after cleaning the diaper, after coming from bathroom, or your hand is dirty. And sterilize the feeding utensil and breast pumps by washing with soap water, warm water, and boiling water, or keeping in steam sterilizer for at least 6 minutes. And use of personal protective equipment like mask if you have respiratory infection. And also bundle approach to prevent infection through IV line, through ventilator, or through urinary catheter. If there is urinary catheter, never keep the bag above the surface of the body. Keep it below the body of the baby. And the healthcare worker vaccination is also important, and always prefer the breast milk over formula feed, and formula feed should be preferred over IV fluid, and avoid getting admitted in NICU for unnecessary reasons. And thank you for your patient listening. And here you have learned how to prevent infection in newborns. both at home as well as in ICU. Thank you very much.